Hello everyone, David Wilson here from Dr-stemcells, and in today's video we're going to look at a really exciting paper, and I'll just pull it up here, which is looking at the safety of multiple intravenous infusions of adipose-derived mesenchymal stem cells. This is something that I've been looking into more and more recently as time passes and we discover that patients with chronic problems, sometimes they have need for injections that are not really practically viable in order to be able to inject them from a distance, and those things are resulting in more and more interest being taken to this field, the field here of systemic injections for these patients. And this is a really exciting new field of medicine where we can have regenerative medicine. You give an intravenous injection, so into the vein, and the stem cells travel around the system and find the problems themselves. In this paper, they were looking at adipose-derived mesenchymal stem cells. I got very excited. That is my favorite field within the regenerative medical field. I think adipose-derived are probably going to become the forerunner and the front runner for choice for patients. It's easily accessible, they're low risk, and they tend to be very high yield. In terms of a adipose harvest or a fat suction, you get a lot of cells for a little effort. You can compare this to bone marrow, where you have to put in a lot of side effects. There's pain, there's tenderness around the area, and you get actually quite a few less stem cells per milliliter, significantly less. So that lower number results in the fact that I think adipose-derived is going to take over. Now, there are a few things we have to find here which are very interesting and very important to mention. This is a really, really interesting study, and it's very exciting because as they look at this, however, one thing which I don't do in my practice, I do not offer allogenic stem cells, that is to say stem cells from someone else. I offer stem cells from the patient to the patient. So in this study, they looked at 48 patients who were given intravenous adipose-derived stem cells for COVID-19. COVID has been an absolute curse for the world, but one thing it has done is it has introduced a lot of research interest and money to groundbreaking new techniques like regenerative medicine for trying to find alternative ways to treat people or give better outcomes. One of the things we can see then happening is that we have research now coming on to, for example, regenerative medicine to see if we can give patients a better outcome. This study looks at these 48 patients who were randomly assigned to either be in the placebo group or the mesenchymal stem cell group. Now, they were given allogenic mesenchymal stem cells provided by this Hope Biosciences, so that's what the HB stands for, and they were then given intravenously at 0, 3, 7, and 10 days, so 4 treatments within a very short period of time, and they were given 100 million cells. So 100 million cells or the placebo group. The purpose of this study was to try and figure out if these cells are safe or not safe, really. And this is interesting. So the primary safety endpoint was incidence of adverse or serious effects. Secondary endpoints were incidence of specific adverse effects and alterations in hematology. So they wanted to see were there any blood changes or blood test changes after this. Results, the majority of adverse effects were mild in severity. The group who received the stem cells showed a higher incidence of heart failure, anemia, anxiety, and diarrhea, while the placebo group had an increase of headaches, fatigue, chest discomfort. Deaths were attributed to severe complications due to COVID-19 and were unrelated to the study. No adverse effects were attributed to the treatment. Hematology and coagulation panel alterations were not associated with the stem cells, and analysis of the inflammatory markers showed that increased levels of interleukin 6 and CRP over time came in the stem cell group. Whether that means that these were people who were more sick or whether it means that these were people who actually had an increase in inflammatory markers because of the stem cells still needs to be discussed. So we're going to go a little bit further down and see if we can find some interesting things about the discussion here. Let's take a look at figure 1. Here we have how they found the patients. They were assigned for eligibility 3 to 2, so 48 patients, 33 in the group to receive stem cells, 15 in the placebo group. Discontinued 17, withdrawal by subject 1, FDA clinical hold 5, discharge or transfer to another hospital 3, and death 8. And in the other group you can see death 2. So this is a 2 to 1, which would be equivalent to 4 or 5 patients in the other group. So a little bit more people died in the stem cell group. This would make us wonder if the stem cell group were more unwell or if the stem cells themselves made them have a weaker immune response. I'm not sure. They then looked at the efficacy analysis, safety analysis, and you can see the total number here, 33 and 15. Now we're going to go to the discussion because there are a couple of things that are very interesting here. We have the demographics on the left here. If you're interested, just pause and take a look at that right now. we have the comorbidities and concomitant medication group, and you can see that in the group where adipose-derived stem cell patients, the number of comorbidities per subject was actually 3.5, and the placebo was only 2. This shows us that there were more sick people, and they were sicker in the stem cell group than they were in the placebo group. We can see, though, that, however, 100% of them had comorbidities, and in particular, of particular interest here for this would be diabetes mellitus type 2 and diabetes mellitus type 1. And you can see that in the stem cell group, 5 had, so that's 15%, but 20% in the placebo, 9% in the stem cell group here, and 20% placebo. So you add those two together, and that means that here we have 40% of patients. I'm not sure why they have not said type 1 here. I don't know if this means type 1 and type 2 or what. Presumably it means not type 2, so that would be type 1, because otherwise they'd be in this group here. No other problems. Here we have 3 in the stem cell group, but 3 in the placebo group. Hyperlipidemia, so high cholesterol, 5 of them. Obesity, 4 versus 1. And obesity is actually one of the main causes of death from COVID-19. It's one of the worst examples of comorbidity, so disease at the same time. Number of medications, number of subjects with medications going on at the same time, all of them except 1 in both groups. So almost everyone was on other medications. And here we have a group of medications that are looked at: melatonin, 25, methylprednisolone, 25. Now this is a big deal. So let's try and round this down to what we think would definitely play a role in the effect we can expect from stem cell treatment. Ivermectin shouldn't make any difference. Hydroxychloroquine shouldn't make any difference. Methylprednisolone will definitely make a difference. Methylprednisolone is an immune suppressant, and it helps reduce inflammation, but in so doing it's going to reduce the effect of a stem cell treatment, because stem cell treatments cause the body to have increased inflammation and increased healing using your immune system. A steroid treatment, on the other hand, dampens down the immune system, and therefore you're going to get a conflict where the stem cells are trying to increase inflammation and regeneration, and the steroids are trying to reduce inflammation, and therefore will result in reduced inflammation and regeneration. Table 3 here, we have adverse events. Let's take a quick look at what they found. There are some interesting adverse events here, and some that are really not worthy of noting. Body aches, you can see that there were quite a few. The thing is that with COVID-19, and many of you will have had it, you will know that these things can happen. Cardiopulmonary failure, not expected. Cough is expected. Headache is expected. Hyperthermia is also expected, fever that is, and fatigue is expected with COVID. Adverse event severity, mild, moderate, severe, life-threatening. 1 life-threatening in the stem cell group. In the placebo group, there were none life-threatening. 8 fatalities in the placebo, or in the stem cell group. 2 fatalities in the placebo group. And then we have attribution to study drug. They say that unlikely, unrelated, and serious were these ones, obviously, who had passed away. Now, they then looked at blood test results, and what's very interesting is that after the blood test results, it seems like there were absolutely no adverse effects from the injections. And the reason this is really exciting then is what we can learn from this paper. So let's go back to that. One of the reasons why this paper is so exciting is that with a 3-day window between 4 treatments with 100 million stem cells, the patients still had no other adverse events than related to their obesity, their COVID-19, and their sickness, it seems like, based on this study. This gives us a lot of promise for rapid intravenous infusion of stem cells, and I would love to see a same study done on intravenous stem cells from the patient's own body. That is to say, autologous treatments, because autologous treatments are actually easier for the body to accept. There's less likely to be any kind of rejection, although in this paper they did not see any signs of adverse events. This means that perhaps for diseases like neurodegenerative diseases, ALS, MS, and the other sicknesses of the brain, dementia, Alzheimer's, even aging, might be reversible by autologous stem cell treatments or allogenic. Allogenic will have the advantage of coming maybe from a younger patient and able to bring youth and health back to older people. But even autologous stem cells from your own body, for your body, they have your DNA, remember. They have the full recipe book, and they might be able to restore function in otherwise sick and unhealthy tissues. This also means that we have now a safety study saying that you can give high doses repeated with short interval, and it seems to be safe. Now, we cannot say definitively that this is now guaranteed safe. We need more studies to look at more of the safety data, but for now, this is a very promising early start. I hope you enjoyed this paper. I certainly did. And join me in the next video as we look again at more of the current stem cell research coming out. I'll see you in the next one.